live, and hopefully a lot of doctors are still have joined in. Let us start question answer session so that we don't miss any question today and no question leaves unanswered. I have a beautiful case of fatty liver to discuss. When everybody joins in, I'll start that case, and that case I have the reports also where the patient's liver size was increased. He had grade 3 fatty liver. After our 1 month of medicine, it has come to grade 1. All the reports, liver function tests have come to normal. The patient's appetite is improved and he's feeling much better. So this is how we'll discuss this case. But first of all, let us discuss some other symptom, other case or other questions which we have. Good afternoon, Dr. Shoaib. Always on time. Good. So let us discuss some more cases now, or some more symptoms. For example, I had a case. I had a question on the WhatsApp. It's on my WhatsApp. And always tell you that don't get on WhatsApp because it's difficult for me to have both the social media working. Yes, Dr. Smith, good afternoon. Good afternoon, Dr. Kocher, Tony, Avani. Yeah, it's good that everybody still has come online so fast. So an interesting question was there that a patient comes. Good afternoon, Dr. Vishaka. A patient had come to me. A doctor had asked me a question. Ke, sir, whenever the patient comes to me, he is well built. He eats good food. But he keeps telling me, sir, I eat food, but मजा नहीं आ रहा खाने में. I'm not enjoying eating, but I like eating and I eat good amount of food. Now this was a constant symptom the patient was telling to the doctor, and the disease was not getting cured. Yeah, good afternoon, Dr. Gupta, Dr. Pratap Kumar. So this was a symptom, and the doctor told me, sir, what to give. So as far as the history, good afternoon to Meera. So as far as the history goes, I worked up the case and gave the remedy. What is this symptom called as? Welcome, Dr. Babel. What is this symptom called as? You will encounter a lot of cases where the patient says, sir, hello, Dr. Alexandra, where the patient says that I like to eat food, I like to eat good food, but I don't enjoy food. This is a very, very important and typical symptom of a remedy, which you have to understand because this is a prescribing totality, prescribing totality. What symptom will you take for prescription? Yes, anybody? What symptom is there for prescription? The patient says that I eat food, I eat a lot of food, but I don't enjoy food. मजा नहीं आ रहा खाने में. Sometimes we feel what is that patient is trying to tell us. Now understand what is the body trying to tell us. So you must have heard a lot of symptoms, lot of rubrics in the repertory, but it is so important. It is so important, to interpret the patient's language. As I always tell you, before I start answering questions, first, can you answer my question? The patient says, delusion as if the food tastes tasteless. No, here there is no regard to taste. The patient says, I eat good food, I eat 4-5 chapatis, I eat rice, I eat paneer, I eat everything I eat. But खाने में मजा नहीं आ रहा. This is the typical wording. I am not enjoying food. Whenever this type of symptom comes, normally we feel okay, the patient does not understand because he is eating so much food and still he feels कि मजा नहीं आ रहा है. So what he will like to eat? He has not told you something about the taste. So this is a very, very typical symptom of very, very interesting remedies. I'll tell the name of the remedy, then you tell me the symptom of that remedy. First, you must think about natramur. Second, think about rustox. Third, think about opium. And fourth, think about China. These 4 remedies I have used. Of course, there are a lot many relishes cannot. So this is a very important symptom. Appetite is ravenous, or appetite is canine, or appetite is excessive, but without relish. This is a very, very important symptom. These days I am getting a lot of patients, maybe post-COVID also, and these 4 or 5 remedies have given me very, very good results. China, rustox, natramur, opium. Of course, in sparing cases, I have used ferrum metallicum, dulcamara, silicia also, pulsatil also. These 4 or 5 remedies have given me good results, and do use in your practice. In this COVID scenario, you will get many of cases. So let us start with the questions. if patient said he feels as if his cheeks are going inside and is getting thin, how to take the rubric? Now see, if the cheeks are going inside and the cheeks are getting thin. Now sometimes what happens, doctor, every symptom basically you must not take for prescription or take for interpretation. But if you have asked me, there is a very interesting symptom where the patient thinks that he's going thin, and you will see that these remedies basically are used in diseases where, yeah, never use that rubric. Okay, so I was just telling the symptom, Dr. Jadhav, that he feels that it is going thin. Now there are two interpretations, Dr. Jadhav. First of all, a normal doctor will say thin and then he will go basically about that. But I would suggest you tell the patient that the cheeks are going thin means they are growing smaller. Whenever the patient says something is growing smaller, it is a very important remedies: carboveg, nitric acid, and one other remedy, stramonium, and of course platinum. Don't forget that, because the platinum ego, if somebody has hurt, then everything goes smaller and smaller in platina. Now this is the implied rubric, implied symptom of that thing, of that symptom you told. Of course, if you just want to take exactly at verbatim, then there are rubrics where the patient says, there are remedies the patient says that something is growing thin. And then the remedies are sulfur, geranium met, and third, the remedy is a very interesting remedy that is called belladonna. But I would suggest you to take the rubric smaller, because that will work better, because everything which is going smaller, I have found very good results by taking that rubric rather than the rubric of thin. Okay, I hope you got the answer. Now then, see, in mouth you can also take the rubric cheeks thin or saliva thin or lips thin. There are a lot of things in mouth, but then you'll be confused. So in mind, if you go and see the rubric, it will be very interesting. Next question. I hope you got somewhat answer. I just asked few questions to the patients more, and then he'll tell you something more. Yes. So next question. Sir, I want to see the result of homeopathy in plants, as I am right now in third year, not having much exposure. I am growing coriander plant, so I can use calcarea first for roots for growth. I think in the last YouTube, I had told you few remedies which you must use, and I had told you a case of a lady who was pregnant, and that the liquor was less, and the doctor said if in 1 week the liquor does not improve, we have to push amino acids. And we had given that patient a fantastic remedy, lecithin. And lecithin I gave in trituration, and it had wonderful results. In plants also, you must think about these remedies. First remedy you must think about is lecithin. Second is alfalfa in low potency. If you can get alfalfa in 12C potency, it will work very nice. It will work very nice. Do think about alfalfa in 12C potency, lecithin in 6X potency or 6C potency. One more remedy that you should think about, last time also I told you, that is cod liver oil. Cod liver oil also in low potency 6. I had a case of a plant where in my house there are a lot of plants. The plant was not growing, it was not growing. So I did something very unique, that I sprayed. Remember, I did not give, I sprayed cod liver oil 6C potency on the whole plant. And now after 3 months, the plant is outgrowing the pot. See, one beautiful results. In cod liver oil 6C in spray, I put about the ratio is 1:10, put 1 ml in 10 ml of water. So if you're taking 50 ml spray, then you take 5 ml of the medicines in that spray, and that spray on the plant, and I've got very good results with cod liver oil 6. Of course, if the plant is infected by a fungus or in a disease, the leaves are becoming black, then you must think about remedies like Echinacea, Azadirachta indica, and Calendula. That works very nice. So you can, both are there for increasing the growth of the plant, no pathology. Second, there is a pathology, there is a fungus, there is a disease, and then spray this. I normally spray now because I have good results, and you will get very good results. Okay, so you can try that. Please write last remedy for plant. Dr. Babal, cod liver oil. Cod liver oil. That's the remedy which I told. Now, cod liver oil, I have explained you in one of the one of the YouTube where I told you some symptoms of cod liver oil also. Can you remember that? Cod liver oil? Anybody? I told you cod liver oil, the name of the remedy is Oleum jack. Oleum jackarus. Cod liver oil. Oleum jack. It's a very interesting remedy, Oleum jack. That is cod liver oil. So I hope you got the answer. Next question. So I was just discussing with you today a case where I'll just tell you I'll show you the reports. Okay, okay, I have one question. 59 years old lady teacher came to me. She's on dialysis. 2 years before dialysis, creatinine was 6. Now it's 2. How to enter in case she wants to stop her dialysis by homeopathy medicine? Okay, so Dr. Meera, it's a very, very complicated case, chronic renal failure. It does not seem so easy. Of course, I have a lot of cases that have good results. But the first thing, you have to understand what is the patient trying to tell us. Every patient, remember, every patient of renal failure has some typical symptoms of that personality. Once I had told you a case where you must understand that a patient has a problem in the smell. The patient comes and tells us that I cannot smell this, I cannot smell that, and I cannot taste this. Bread tastes like salt, and salt tastes very sweet. There are a lot of problems in the taste and smell that I've seen in many of cases. This is the acute presentation of this chronic disease. Next, in the mental sphere, if you understand where was the thought process of the patient, where he did not want to do something in life, he wanted to take out of the body, take out the system, but he was not able to take out that thought process, which has created a lot of inroad in his life, and because of which he has landed up to renal failure. So in acute case, I have seen beautiful remedies like taste, smell, stools, and electrolyte balance. These 4 symptoms, these 4 pathologies have a very, very interesting symptoms. So do think about this, and when the acute phase goes off, do take a case, and then you'll see the problem is he is not able to eliminate some thoughts where he has put in his mind and not able to come out of that. And in that case, the remedy will work very nice. Okay. So this is, you have to think about renal failures. For ovaries. Okay, I don't know. I will tell you a case of, I'll first go for that case. So this was a case that came to me for grade 3 fatty liver on the verge of becoming cirrhosis of liver. See the report of the patient. Grade 3 fatty liver. Can you see this? And his LFT also was very bad. So after a 1 month, see the size of the liver, it is 18.3. Can you see it? 18.3 centimeters, and going to cirrhosis of liver. After 1 month of treatment, the patient came today. Of course, all his LFT came to normal, and we were interested on the size of the liver. That also has come to grade 1. See the size of the liver, now it is only 16 centimeters. And the report shows only grade 1 to occasional grade 2 fatty liver in just 1 month's time. So this is how I wanted to show this case, because once it is cirrhosis of liver, it becomes so difficult to answer, Yeah, you can share your case, but I'll just complete. So did you get that the report? The liver 18.3 centimeter after treatment. Now it is 16 centimeter and only grade 1 to occasional grade 2 fatty liver. So this is what I want to tell you in cases of liver cirrhosis. Of course, I'll have a lot of cases that I'll discuss in general How is the cirrhosis treated? Now, one question, can we have anger? Is it possible for a patient to need lycopodium and to not have anger? See, always I tell to my who is always follow to my students and doctors that don't be very fixed and don't be very prejudiced. Because what happens if you have only one bent of mind that Merksol is anarchist, revolutionary, or lycopodium is angry, then you cannot see the other part of the remedy. If you go and see lycopodium, lycopodium is also a very cheerful patient, especially lycopodium. There is cheerfulness in the afternoon, in the evening, in the bed, in the night also. In fact, you'll be surprised, Dr. Alexandra, a lycopodium patient is very cheerful in cough, very, very cheerful, very, very cheerful in cough complaints. That's a very, very interesting symptom of lycopodium, cheerfulness. So this is definitely, you can have these type of symptoms. There are a lot of other symptoms of lycopodium. I don't want to get into that, but it has these symptoms. Of course, then you have symptoms of lycopodium anger. Lycopodium is very disputous and all. But cheerfulness in cough, especially if you have a very chronic cough patient and the patient is still cheerful, close your eyes and give lycopodium. Anger part of lycopodium, remember that lycopodium patients basically are angry on themselves. This is very important. Angry on themselves, angry when they wake up in the morning, angry on trifles. And whenever the lycopodium patient gets angry, there is trembling, anger with trembling. This is lycopodium. So we can definitely have lycopodium, this part also. Okay. Yeah, hello. Can you share any case of infertility? Yeah, of course, I can tell you that infertility is definitely curable, and this I have cases. So maybe if you can send me a number, I'll send you some videos to see that infertility is curable, and it is definitely curable. There's no problem. I have cases where the patient has conceived after 20 years of marriage. 20 years of marriage. The lady married at age of 20, and now she was 41 when she conceived first time. And surprisingly, after the first child at 43, she conceived one more time. So I have a lot of cases where infertility is definitely curable, but definitely everything I have not cured. Everything is not curable, but definitely infertility is curable. Approach in liver case chronic. Yeah. So, Dr. Shah, I was just telling you that only. In cirrhosis of liver, when I get bulk number of cases so that I can exactly tell you the approach. I'm showing the results black and white so that you understand that it is curable. And when you see the reports, see black and white, you get a lot of confidence that yes, if I can do it, others can do it. That's why I always make sure in most of my cases, I always show before and after results, because maybe years back I was having, I used to shoot all cases, but now because of shortage of time, I cannot shoot the cases. But I make it a point to at least have the report so that it becomes very authentic when you are showing the results. Telling like that only that I've cured cirrhosis, I've cured cancer, I've cured renal failures is sometimes not taken very nicely by the students, because they feel this doctor is telling everything is cured. But when you show results like this black and white, today only the patient came, and it is very confidence giving results, I can say that. So maybe in near future, if I cure, I've definitely cured cases also. I'll definitely have one thinking pattern of liver cirrhosis and liver disorders, and maybe I'll tell you something about that in future. But as you told me that you want some input. So in liver cirrhosis, one thing or some things which are very important, that the patient suffers from a lot of congestion. The patient says, right side pe bahut bhari lag raha hai, bhari lag raha hai. Whenever the patient says there is heaviness in the right side, it is always in maximum time because of congestion in the liver. If you can catch the disease on that part, before going to the fatty liver and all, you can treat a lot of cases before they go into grade 1 and grade 2 fatty liver. In those cases, important remedies in this are, first is lycopodium, very, very interesting remedy. Second, Kalicar. Third, cholesterinum. Fourth, sepia. Where there's a lot of congestion in the region of liver. That is the first thing. And there are cases where the liver is enlarged and it is enlarged from a very long time, and the patient does not know, and he keeps taking medicine for gases and all. In that case, if the liver is enlarged and has been a very long time, first remedy that everybody should think about is Chionanthus virginica. Second remedy which I use, which is very rare, is Menispermium canadensis. This is second part you have to see in cases of liver. Third thing, the patient complains about fullness. ऐसे पेट पूरा भरा लगता, fullness in the region of liver. Whenever there's fullness in the region of liver, then you have to think about a very, very important remedy you must have never thought about, but do write in your Mater Medica and your notes, Podophyllum. The patient always complains about fullness in the region of liver. Podophyllum, sulfur, Chilidonium and Lycopodium. And whenever there is fullness, no, the patient cannot breathe, so he breathes like this. And he feels better in fullness. So whenever there is fullness in the region of liver and the patient has to take deep breath, my dear friends, remember one remedy that you have to give at that time, and that remedy is Cardus marinus. Very, very important remedy. Very, very important remedy. So congestion, fullness, and the third part in liver, it comes hardness. You touch the liver and it appears very hard, hard. Of course, then your examination has to be good, and then you have to examine which lobe of liver is. But then in general hardness, I had posted one of the, I had posted one clipping, a template of hardness of liver, and the most important remedy that you have to remember in that case is Abies canadensis. Abies canadensis is a very, very important remedy. If there is a sensation also of hardness, you have to think of Abies can. Other remedies you have to think about is China, magnesium mure, iodine, and graphitis. Of course, phosphorus also there. So these are the 3-4 things you have to look for in liver complaints. And then the last thing you have to look about inflammation. Of course, that is first. A migratory pain, a dull aching pain. Always there is a pain. So the patient says that has been part of my life, but now treat the acidity. So there's a continuous dull pain, inflammatory liver. Then think about natrum sulph, Nux vomica, Lycopodium, and Chilodonium. You'll see 3-4 remedies always coming in all the sensation: inflammation, congestion, fullness, and hardness. There are 3-4 remedies that come always, and these remedies become very, very important and useful in treating liver complaints or cirrhosis of liver. I hope you understood something about, and then of course, in homeopathy we have, when is the pain? Breathing in, breathing out, before anger, during, after anger, or the pain is in the morning or in the evening or at night. Then there are different remedies if the patient can pinpoint these type of defining symptoms in liver complaints. So this is a general idea which I am using it now, but then gradually as you start curing those cases, you'll exactly know why the liver has got cirrhotic and how can we change that cirrhotic liver to a normal liver. I do have cases where the whole liver was cirrhotic, hard, and with our medicine it has become normal. Okay. So this is something about liver. Do think in your practice also. Okay. One more question. Sir, kindly share the diabetes mellitus type 2 case is sugar control without any mother tincture. Till what time we should wait for the sugar to come down? Yeah. So mother tincture I used to use before in my practice. Like I used to use Cesium jumbolinum, Gymnema, Tinospora for diabetes mellitus. In fact, for a buffer. That means if we are giving medicines, so that we give mother tincture so that it does not increase more. But of late, Dr. Kadri, I have seen that in homeopathy medicines also there are certain medicines and certain approaches where we can definitely treat diabetes mellitus. In fact, 2 days before I had posted a case of diabetes where the HbA1c count was 13.5, 13.5. So the patient did not go to the other doctor, he came to me, and with a good case taking and all, I gave a medicine, and after 1 month, the HbA1c came to 8.5. So I gave only that 3 doses of the indicated remedy, and it has worked. So mother tincture, I would say I was using it before, but now only rarely. Sometimes I use if I feel that I have not got the remedy right. So sometimes you can use mother tincture so that the sugar is controlled by the time you cure or treat that patient with your single dose medicine. The mother tincture used, actually I have told you the name of the name also. Yeah, Carbovage in case of condition, I do use that. Dr. Gupta, if your question, yeah. 20 days after eating ice cream yesterday, she is feeling dryness in throat and chilly, especially in head, along with weakness. What can we think after eating ice cream? So, if first of all, if let me tell you, whenever the word ice cream comes, which remedy comes to your mind? Whenever in our Mater Medica, whenever we are talking something and ice cream comes, what remedy comes to your mind? Anybody? Arsenic, yes. Anything else? Pulsatilla, yes. Pulsatilla, aconite, hypersulf, yes, very nice. Phosphorus, yes, very nice. So, most of us, we think about the first remedy, that basically pulsatilla, yeah. So most of us normally, when I used to ask these questions in the class also, so the maximum answers was pulsatilla, phosphorus, arsenic. So these are the three remedies which we jump upon and we start getting the results. But whenever the patient complains of something, whatever complains, and it is caused because of ice cream, then don't always think about pulsatilla, because pulsatilla, of course, it includes everything in pulsatilla, but think of some remedies which are very, very important, and I would say sometimes not used very frequently. And the first remedy that you should think about in these cases, of course, arsenic is there, but do think in your case, Dr. Gupta, Kali Ars. Kali Ars, if you have read Kali Ars and Kali Iode are one of the very interesting remedies where everything is aggravated because of ice creams. Throat complaints, chest complaints, cough, everything. I told you once something about Kali Brome, Now in Kali Ars, you have to remember it's now something about Kali Brome that I told you before we go to Kali Ars. See, Kali Ars is a very, very interesting remedy. Of course, all remedies are interesting, but Kali Ars is a remedy which is very chilly and which is very sensitive to cold. Let me give you one clinical tip. If it is arsenic indicated in your case, especially now in is winter season, COVID season, and if arsenic is not working, and you have to find a remedy which is very close to arsenic but not arsenic, first do think about Kali Ars. It is a very, very interesting remedy. In fact, in Kali Ars, it is written, remember this wordings of Kali Ars, cannot get too warm even in summer. Cannot get too warm even in summer. Now, if you see the repertory that wears a fur cap even in summer, Kali Ars is not there. Kali Ars is not there. So Dr. Boger, I had posted a template of Dr. Boger where he wrote that the use of repertory is not too much, but our Mater Medica should be learned and thought about because it has a wide variety of symptoms. An example I have told you, wears a fur cap even in summer, Kali Ars is not there, nitric acid is there, soranum is there. But Mater Medica wise, if you open Mater Medica, Kali Ars, it is written, cannot get too warm even in summer. That is Kali Ars. One thing, intolerable itching in Kali Ars, aggravated by undressing. That is Kali Ars. You understand? So do think about Kali Ars because it's a very interesting remedy. I hope I have answered the question, Dr. Gupta. Loss of sensitivity in Kali Brome. Yes, very right. So let us go further. Anything cold elements can be taken. Yeah, but see, in homeopathy, if the patient is very pinpoint in telling you ice cream, so do think about that, because we have cold drinks, we have ice cream, we have ice water, we have chilled water. So there are a lot of very particular modality. If the patient is telling you something, then do take it. Don't put your words and your thinking. That is wrong. So if this patient is telling you ice cream, then you have to definitely think about ice, because if you take anything cold, so there's a wide variety of remedies, right from aconite to zincum. You may have about hundreds of remedies. But ice cream, you have very peculiar remedies. Okay, so in this, you have to differentiate. Can't feel the sensation in calibrom. Yes. Yes, right. So I was just thinking that, do you remember calibrom? Of course, in calibrom, if I remember what I've taught and what I teach normally, one thing you have to remember in calibrom. Of course, there is lots of sensibility basically in the fauces, in the larynx, in the urethra, the entire body that is there. But one thing I told you in calibrom that you have to always remember, and that is restlessness and sleeplessness. Restlessness and sleeplessness due to grief, worry, property, or reputation. Reputation in today's world of psychosis, loss of reputation from business, embarrassment, that is calibrom. And I told you, remember calibrom, you will require calibrom lots in your practice, because in today's world, there is sleeplessness because of worry, lot of stress, lot of grief, because of lot of loss of property and loss of reputation. इज्जत खराब हो जाती है. And we always think about remedies of esteem, and then calibrom is never thought of. So do think about, I hope you remember that I have told you, no? I hope you remember that. So there are some things of the remedy that you should always remember. There are some things in the remedy you should always remember. Don't just remember mater medica. For loss of sleep, calibrom, passiflora, pisidia. For this. You have to remember why there is sleeplessness. That is important, Sleeplessness because of worry, grief, loss of property, loss of reputation from business embarrassment. Very close to hyoscyamus. Very close to hyoscyamus. Okay. Normal, if you have loss of sleep, you can always think loss of sleep because of nervine irritation, nervousness, and you can give califos in trituration, and it will give you good results, but not curative. Dr. Ansari, what is the treatment way of trauma of intrauterine life? What is the treatment? No, intrauterine life trauma. If you want to treat that, of course, then you have to ask, whatever I do is ask the history of the lady during the pregnancy, what she has suffered from, what emotional trauma she has suffered from, what symptoms she has suffered from. And then you can always treat those elements intrauterine, because of that element of the lady during pregnancy has given rise to some element of some deformity or some symptoms in the fetus. Yeah, in califos, of course, in calibrom, you always remember one thing, that is loss of memory also, calibrom, loss of memory. That's also important. So veratrum viridi can be used for person why don't have high BP symptom but have veratrum viridi can be used for persons why don't have high BP symptoms but have high BP. No, I did not get your question, Dr. Chatterjee. Can you again repeat that? Whatever I remember, that you want to ask something about veratrum viridi, about why it is not used for blood pressure. That's what I can get from your question. So see, veratrum viridi basically it is never written directly. It is for blood pressure and all. If you read veratrum viridi, Dr. Chatterjee, if you have read Boric Mater Medica, open Boric Mater Medica, you just see the first two lines. I think it is written auricular fibrillation, and second symptom that is very, very important of Boric Mater Medica, that is induces fall of both systolic and diastolic blood pressure. Such a fantastic symptom of veratrum viridi. It decreases both the systolic as well as the diastolic blood pressure. It is written so plainly in the remedy. What more do we want for treating blood pressure, And it is written, in one Mater Medica, I don't remember the name of it, it is written, it produces violent congestion at the base of the brain, That is important. Every patient of high BP will tell you that there is a lot of heaviness at the base of the brain, there is pain at the base of the brain, and that is a very important symptom of veratrum viridi. Are you getting me? And because of that, the blood pressure is so high that it causes fainting. That is veratrum viridi. Sudden effects, numbness. It reduces in fact, if you see the Fataks Mater Medica has written directly, reduces the blood pressure. It is written so directly in Fatak's Mater Medica. So it is a wonderful remedy for treating this complaint, but symptom has to match. That is important, because if you go to that Mater Medica part of Veratrum Viridi and see the heart symptom, or you see the symptom or the back symptom, it is written cannot hold the head high. He cannot hold the head high. There is so much pain and congestion in the base of the brain, he cannot hold the head high. So he's like this only. कि वे पूरा blood supply नीचे आ जाए. This is Veratrum Viridi. And if I tell you opposite part, the patient always comes and sits like this with the head high or back of the head. Opposite to Veratrum Viridi. Which remedy can you think about? Anybody? Wow, fantastic, so nice, Dr. Shoaib. And thank you so much that you remember the remedy, because I am very happy that whatever I have taught you, you do remember. So Seneca, fantastic remedy. I told you a case where there was pain in the eyes also. You know, the patient sits like this. That is Seneca, fantastic. So I hope, Dr. Chatterjee, I could tell you something about Veratrum Viridi. In temporomandibular joint pain, yes. In temporomandibular joint pain, I have good results. Basically, what happens? These cases have a problem where, because of excessive heart chewing, because of excessive opening the mouth, and because of lot of exercises of the mouth, the patient develops their TM joint. Of course, it's because of symptoms of arthritis also. But I have found very, very useful the remedies like Esafoetida, Merxol, and Calcarea carb. These three remedies have given me very good results in cases of temporomandibular joint pain. Acute remedy, as I always tell you, acute remedy I have used many times in practice is Rustox and Guaiacum. Okay. From you, sir, we have learned a lot lesser known remedies for common. Thank you so much. Thank you, Dr. Chatterjee. And it feels very nice so that people are learning and we are sharing a knowledge. That is important. Okay. Seneca's coldness of feet and hands, fingers, and cold on touch, extremity sensitive to cold air, exposure to throat, complaints of cough and coryza, and white expectorant early in the morning. Last one. See, Dr. Chaudhary, Ramcharan Chaudhary, if everywhere there is icy coldness, icy coldness, then you have to see why there is icy coldness. I told you in one of the remedies where the patient it is written lacks animal heat. Can anybody tell me the remedies? Lacks, or exact wordings of the Mater Medica is deficient in animal heat. Can anybody tell me the symptom, the remedy? Yes. Deficient in animal heat. If you cannot understand that case and the patient is absolutely chilly, lacks is deficient in animal heat, there are two remedies which are written in a Mater Medica, very, very important. The first remedy is alumina, and the second remedy is given is silicia and alumina. See, this is the what you call, I would say, the beauty of a Mater Medica. I told you Kaliyas cannot get warm enough even in summer. I told you remedies like wears a fur cap in summer, nitric acid and soranum. But in alumina and silicia, it is written deficient in animal heat. This is a beauty of Mater Medica. How you interpret a symptom in a patient, that will give rise to a different remedy. This is, I want to tell you everybody, this is important. So coming back to icy coldness of feet, and the remedy you should think about, first is Ledampal. Second is sickle core. These two remedies are very, very important. Ledampal and sickle core. Of course, then you can also think about remedies like Agaricus muscaris. You can think remedies like arsenic. But these 3-4 remedies are very, very useful and very, very indicated in this complaint. And then you have remedies like Rustox, you have phosphorus, you have silicia, you have soranum also, and Hiparsulf also. There is these type of symptoms. Patient has to clear the throat every time when or without discharge, as if comes irritation throat. No, Dr. Sangma is like this every time. So this is basically, he has to every time hawking of throat, and he has to clear the mucus. Now, there are lot and lots of remedies, doctor. There are lot and lot of remedies, and you can start thinking of remedies right from simple nitramur to nitramars, sanguinaria, phosphorus, arsenic, alumina. Especially the patient tells you that whenever he gets up from the bed, he gets this hawking thing about arnica, china, and ferrum metallicum. Of course, arsenic is there, nitramur, tuberculum, nitramars, lachesis, phosphorus is there, but on rising, these are the remedies. That is called as hawking. Every time it does and starts speaking. So these are the remedies. And this is the symptom you have to take. Is there any cure of arthritis in homeopathy? Yes, there is definitely a cure of arthritis in homeopathy. Though difficult, but not impossible. I have definitely cured cases of arthritis where the patient could not walk and climb the stairs of my clinic, and now the patient is able to walk and climb the stairs also. We have cured a lot of cases. It is difficult but not impossible. Looseness of trachea, sensation of adherent. Looseness of trachea. I did not get the exact symptom what you want to tell. Of course, there is a sensation of looseness, like there is a remedy called as phosphorus, where it is written that there is a skin sensation of larynx feels very loose. Usko loose lagta hai. That is phosphorus. In fact, there is a remedy called as allium cepa, or calcarea carb also is there, where the patient has when the patient starts coughing, there is loose sensation as if something is loose. It will break open. That is allium cepa and calcarea carb. So these are the remedies of what I can understand and answer. Adherent, okay. कुछ चिपका हुआ है. So there is it's a very interesting, बहुत बार हमको मिलता है. Very nice question, doctor. Very nice question, Dr. Dasari. Sorry. So ये symptom हमको मिलता है. Patients बोलते हैं ऐसे लगता है कुछ चिपका हुआ है और बार उसको ये निकालना पड़ता है. Now, अगर उसको पेशेंट को लग रहा है बहुत चिपका हुआ है और बार निकालना पड़ रहा है, you have to think about remedies, lachesis, nitric acid, causticum, and zincum metallicum. Sir, is there any specific remedy for irritation and itching after shaving, both dry and wet shaving? Yeah, so just see, whenever you shave, there is a lot of itching in the on the cheeks, So first of all, if the patient is having beard like me, then you have to think basically whether there is eczema, ringworm, tinea, psoriasis of the beard, that also can cause itching. And if just by shaving, a full shave he has taken and the cheeks have a problem, then you think the patient, whatever he is using after shave is affecting the patient. You can take in generalized sensitiveness, and then you can prescribe the remedy. Like we have arsenic, we have calcarea carb, we have china, we have Naxomica, chamomilla, and ignitia for these complaints. Bovista basically have tetary eruptions. That is important. Specific. If basically you want something specific, then you have to think about tellurium, bacillinum, echinacea, and azadirachta indica in low potency. Sir, persons feel pain in the left knee when she get up and sit only. Otherwise, no pain. Feel well when hot bag are applied. Yeah, so whenever we have case where the patient tells that you apply hot bag or he's aggravated by waking, of course, one remedy that you have to always think about first in your mind is, of course, Rustox. But in this generalized, if you see, if you see generalized that the patient has a problem in the knee and he puts that what you call bag and he feels better, write down the name of the remedies. It is very important. Arsenic, Cantharis, and one rare remedy which I have used in my practice and I've got very good results, that is scorpion. The name of the remedy is Androctonus. Androctonus. Pain in the knee, which is better by warmth or hot application. Do think about these three remedies: arsenic album, cantharis, and Androctonus. Can you prescribe anything now or need to book an appointment? If it's a chronic case, I'll be happy to book an appointment. Sir, any treatment for leg numbness and pain during walking? Yeah, I think this question we have answered before, but first of all, it depends on which age the patient is in. In old age, pain in the legs basically is very common. That is because of electrolyte imbalance and loss of nutrition in the muscles of in the calf muscles. Important. Second, if the calf muscles are paining without any reason, do think or examine the patient for Doppler study whether is suffering from thrombophlebitis, varicose vein, that part. Third part, if there is just pain and there is no symptom available for you, then you can take a remedy which basically works on the musculature. And the first remedy that you think about is MacPhos. Low potency, biochemic also works. Second remedy that you should think about if there is nothing and you can't get any symptom, that is salicylic acid. A very, very interesting remedy, salicylic acid, and that is MacPhos. Still, if you feel that there is a lot of pain and it is not getting relief, maybe the patient has trauma, but he has forgotten and still the pain persists. Then the remedy becomes belly spur, deep wounds inside the tissues. And the fourth remedy, that is from exertion, but the patient feels exertion I am doing every day, but he does not understand that the age is going on and he has to reduce his exertion. The body is not able to cope up. Then you have to think about Arnica montana. These 4 or 5 remedies you must think for these type of complaints. Okay, 50 years. So these are the 3-4 remedies, Dr. Ansari. Sir, which remedy to think of in macular degeneration? Yeah, so such a, such a condition where, macular degeneration, it's a condition where the patient gets to the doctor with a lot of hope. And it is very important to at least give relief to the patient. Today, I had got a case basically of retinopigmentosa where the patient was totally blind, totally blind. But now, after our treatment, he has started seeing red colors and he can now see his own hands. Of course, the case is still going on, and whenever the patients at least start seeing, I'll tell you basically the remedy also. But getting back to the question, see, eye complaints is such an important thing to treat, and of course, there is no specific for these complaints. But the remedy which I have used is the first remedy which you should always think about is, of course, one of the best remedies we have used is phosphorus. Phosphorus, if you read the mathematic of phosphorus, you will find all the symptoms related to eye or major symptom related to eye which we have encountered in our books of medicine. Phosphorus, first remedy. Second, you must think about conium maculata. Third is apis mellifica. And then we have remedies like ruta, we have remedies like nitric acid, natrium and Merxol, which have given us good results. One remedy I would mention in this context is, which I'm using it a lot in my practice now, is cadmium sulf. If you remember, I had told something about cadmium sulf. Cadmium sulf is one of the carcinogenic agent present in the smoke. So in these days, where you're a passive smoker, and you're sitting there, and of course the nose is involved, you get lungs problem, but some patients develop this eye problem also because of passive smoking, and in that case, cadmium sulf has given me very good results. So do think about these remedies in your practice. Extreme irritation on the female genital to scratch with later comes the swelling. Okay. Of course, Dr. Sangma, now extreme irritation of the genitals, the patient has lot of itching. So much itching, it is written in a mathematica that the patient will tear up the skin also. There is so much itching. Which remedy you should think about? Anybody? Which first remedy that comes to your mind? Yes? Anybody? The remedy that comes to our, it's if you get a case of lot of itching in the vagina, a lot of itching in the vagina, the first remedy that you should think about in your practice, remember and write the name, that is Helonius. Helonius, I don't think so it is given in 3 marking in the repertory, but Helonius, I have never failed with that. Helonius diadana, Helonius dioica. It has so much itching, the patient tells that she feels that as if taking the skin out of the vagina, and that is Helonius itching. A very, very interesting remedy. Of course, then you have remedies like calidum is there, creosote is there, nitric acid is there, but Helonius is a very, very important remedy. And one remedy that you have to think about is origanum. Origanum also do things. It's a very, very interesting remedy. Fibrosis in post-COVID cases. Of course, I told you this type of, I told you some of the remedies for fibrosis, like you do think about strychnine phos, do think about kali carb, do think about thiocyanaminium, do think about fluoric acid. But now the cases which I'm getting in my practice, I'm basically getting some beautiful symptoms, One patient came and told me, sir, the lung is so stuck up that I feel while I'm respiring, the lung is not moving. I have to rub the lungs so that I can take a breathe. And the remedy, which remedy gave me good results? Anybody? These are the symptoms. Which remedy gave me relief, Anybody? Watch the symptoms what the patient tells you. The patient tells that the lungs feel so tight, I cannot move my lungs. It feels, I have to rub my chest so that I feel the lung is working. Lung has become so hard. I gave which remedy and it has given me very good results. The remedy that you think about, you have to rub the chest so that the lung starts working. Phosphorus. Yes, the remedy is phosphorus. In fact, I told you a case of COVID where I had used this symptom for that case, and that case had given me good results. Phosphorus. Very right, Tony. So, phosphorus, phosphorus. Any one question? Children's having vision problem because of, there is a lot of problems of children vision, and whatever I am seeing cases today, basically, there are symptoms. Redness, watering, pain, itching. Whatever symptom is, whatever the constitution is throwing, majority use that symptom for prescription. So it's already 1 hour and I have a webinar at 4 o'clock. So rest questions not answered, I'll try to answer in my next YouTube. So everybody, thank you so much. Thank you for joining, and I hope you enjoyed hearing as much as I enjoyed speaking with you. Thank you so much. Yeah, it is origanum. Origanum. Origana is based, no, it's that is not that origanum. You can write the spelling also. Origanum. Origanum majorana. Origanum majorana. Okay. So thank you so much. Thank you.